This decision, it will impact local doctors and fertility clinics here as well in North Texas and Texas in general. Joining us to talk more about that is OBGYN and women's health expert, Dr. Jessica Shepard. Good morning to you.
Good morning.
As a physician, you're in the medical world. I'm sure you're speaking to your colleagues.
Yep.
How do you feel? What does this mean to you?
I think, personally, so there's many ways that I could look at it, and I think even I'm still trying to gather my thoughts from yesterday, but as a woman, as a OBGYN and women's healthcare provider, this is devastating. This comes from years in my career of hearing women in and out of my exam room having their stories or why they would choose to have an abortion or what put them into that position. And I think that's where some of the stigma lies is, again, you can have religious beliefs or you can have social stigma that really precludes how we think about people who make that choice for themselves.
Dr. Shepard, I guess what are some potential dangers or even consequences for people that are wanting abortions right now?
Yeah, and that's what we're seeing now as people are beginning to rally and really think about the kind of strict and severe laws that come in some of the states, such as trigger states that have trigger laws, which really means that now that it's been overturned, we are really starting to see some states who either had a pre-Roe law or had some type of legislation that really said once it's overturned, we're going right back to banning abortion. So that's where you're going to see, I've even heard of some states had to cancel some of their abortion services because of the decision yesterday. So this is where we're going to see a lot of chaos and confusion when you think of a provider perspective and also a patient, because there are so many differences in the laws state by state. And this is why it was so very important when we had it as something that was a constitution, because we knew that abortion is health care and we need to give that right to women for the decisions they make for their own bodies.
Right. Now, what services, if any, will be available to women here in Texas?
That is, we already have the 6-week ban. So I would definitely think that Texas is going to be one of those states where we're going to see a ban on abortion. That's where we're going to see decrease in access and care for women and having to travel. We just recently saw the time that it gets to, say, Kansas from, a Texas city. Now, the part that's really kind of the confusion here is this is going to impact marginalized communities so much more than anything that we can think of. And this is how
Can you explain why, Dr. Shepard?
Absolutely. So when we think of marginalized communities that don't have the access to financially or the time, thinking of just little things like taking time off work to get the care that they need. One, we have a really paucity of abortion care services and clinics here in the state of Texas. So now that they're going to be completely gone, women having to travel to other states.
Right, Melanie had showed us some, over 300 miles away.
And then also what type of insurance they may have. A lot of Medicare and Medicaid do not provide that type of service. And so what you're seeing is now they're going to have to travel further, take off more time. But all in all, what I would definitely say is for women who are watching today is that we really need to put some really good thought onto how we think of reproductive care for ourselves individually in our communities, meaning making sure we have access to birth control, making sure we have access to emergency contraceptive, and also for medical abortion care if that's going to be sent to someone in order to take. We have to think way ahead now because we don't have the access and we don't have the care that we need.
Still a lot to dig into. Dr. Shepard, thank you so much for joining us. For women that would like to, speak to you, and how can they reach out to you?
Absolutely. I think the best way to reach me could be on my Instagram, Jessica Shepard MD. But also, as the Chief Medical Officer of Very Well Health, we pride ourselves on being able to give people the content, resources, and access to healthcare information that they need. So verywellhealth.com is a wonderful site to get information on.
Got it. Dr. Shepard, thank you so much for joining us.
Thank you.
Thank you.